Now, how do we get into the picture?
Now, how did we find Dr. Chris? I think it was because in looking round the web, I think in one of these chat rooms, I came across somebody. I'm not sure about this, but I think I came across someone who was staying in Thailand, and he was staying at a health resort up in the north of Thailand, and he happened to mention cancer care website to me. I don't think he mentioned your name, he just mentioned cancer care. So that's when I looked on your website, and then I think I contacted you by email, and I think we chatted backwards and forwards. You suggested I look on YouTube at several of your videos there. And meanwhile, I had also read a couple of books which changed my view on diet as well. And the two books were The China Study by T. Colin Campbell, and another book by a Professor Jane Plant in the UK called Prostate Cancer. Both of those recommended basically a vegan, strict vegetarian diet, and particularly no milk. And as I had mentioned, I'd been taking the Budwick thing, which used cottage cheese. What does cottage cheese comes? It comes from milk. You see, maybe it's entirely the wrong thing I was taking, and I was taking quite a lot of this cottage cheese. You see,
and you were drinking milk as well.
And I was drinking some milk as well, yes. Not a lot, but I was drinking some milk. Also, I wasn't really so strict with the diet. So when I saw your website and I downloaded your book, this seemed to tie in with what Colin Campbell and Professor Jane Plant said. The only addition, of course, you had was the herbs. But I figured that in China they don't have so much prostate cancer in China, so maybe the Chinese know something that the Western docs don't. You see, so we'll give them a go. Give your herbs, and really tightening up on the diet to really strictly on the diet, no fooling around with it this time, because maybe I don't have another chance.
So there you are on a strict diet, as we said, and then you started taking the herbs.
Yes.
Now, you were on the herb for the initial of 6 weeks.
That's right, 6 weeks.
Let me ask you, before you start on the 6th week, what is your feeling? Do you think that it's going to work for you, or was it just let me try it out? What was your feeling?
Well, this is my honest feeling, because I'm an engineer and I did physics at university. Now physics is based on evidence, right? You have theories in physics. You can have a theory about anything, then you have to demonstrate whether this theory works or it doesn't work. So I approach your treatment with an entirely open mind. It either works or it doesn't work. So I do it according to your instructions, taking the herbs. I must keep to the very strict diet, otherwise you say, oh, it hasn't worked because you haven't kept to the diet, or you've done. I keep everything like you say, and if it works, well done, Dr. Chris. I congratulate you. Therefore, the theory works.
Do you have any preconceived feeling that maybe I just give it a try, but how is it? Were you, when you take the herb, were you confident that I think it's going to work for me, or I am just, as you said, an open mind, let's see how it is.
Well, if I was, let's say this, if I was doing something over the internet and getting some sort of Chinese herbs from China or something, I would be rather doubtful over it, because they might be trying to sell me something, a pig in a poke, as they say in English. But having met you, and it's not just because you're sitting here, Dr. Chris, I've found you always a very genuine and fair person to talk to. I think that after talking to you and
over the net.
Pardon?
Over the net.
Over the net.
Yeah.
I found you. I have confidence in you, and therefore I have more confidence than if I had been just doing it on with some guy on the buying stuff over the internet. But you have given me some confidence and encouragement, and with your stories that you've told me. So by meeting you, I have more confidence in you, and particularly after your last visit to Bangkok, when I came to see you, when you said to me, when I asked you, I hadn't had my PSA check then. My last PSA, as I said, my PSA was going up in a parabolic curve.
Yeah.
I came here to see you and I asked you, what do you think? And you said to me, you said, well, you think my PSA will go down. And I said, well, how can you be so confident, Dr. Chris? And you said, well, you will be my first failure. And you said, well, of course, life is uncertain, you said. I like that bit. Life is uncertain. Yeah, sure, like, I'd probably get knocked over by a Bangkok bus tomorrow. Maybe I do that, yes. But you seem to be amazingly confident. And I went back after our last visit here, I don't think I've told you this, and told some of my friends. I said, well, I've spoken to Dr. Chris and he's confident about it, so we'll just have to see. But it's given me some encouragement to meet Dr. Chris. It really has.
So the first visit that we met face to face was really a fruitful one to you?
Oh yes, I'm glad. I'm very glad we met, because as I say, I find you a very genuine person, and I think you believe in what you're doing. Of course, it comes back to me being a physicist. You may believe in what you're doing, but maybe Dr. Budwig in Germany believe what she was doing. So we have to see whether it really does work. But certainly, I'm so glad to meet you, and it gives me more confidence.